Now, if someone were to ask, what are the benefits of exercise? The answer is there's too many to count. And I'll name a few. Exercise can build muscle strength and endurance. It increases quote unquote good cholesterol or HDL, which helps prevent heart disease. It helps keep you young. So, for instance, certain types of exercise are known to increase growth hormone and testosterone. And these hormones are very important to maintain strength, especially as one gets older. It helps keep your blood sugar in check. So, for instance, exercise or resistance exercise in diabetic patients can benefit them greatly because it helps them regulate their blood sugars better than if they were to not exercise at all. Exercise has been known to help with blood pressure. So we know that certain types of aerobic exercise and cardiovascular exercise programs can indeed decrease your heart rate and decrease your blood pressure. It has also become apparent in the more recent exercise science literature that even resistance exercise can also help with blood pressure. And I think a combination of both cardiovascular exercise and resistance exercise is the way to go to optimize health and wellness. Now, exercise also helps with inflammation, and what this means is that in the short run, exercise does increase inflammation in the muscles. So there is, after you finish your set or finish your workout, you may feel your muscles are more swollen, warm, and those are the characteristics of inflammation. And then there's also something called delayed onset muscle soreness, where the muscle becomes sore, and it is believed inflammation plays a huge role in that. Now, in the long run, exercise actually has been shown to help manage inflammation. So that's a key feature, and exercise may help with possibly with certain inflammatory states. Now, what are the bad things that come with exercise? The big one is overtraining syndrome. So it's a syndrome where basically the body is just overworked. And what happens here is muscle, ligament, and tendons are at increased risk of being injured. So the goal of nutrition is quite simple. It's to prevent this overtraining syndrome. And it does this by helping the body recover faster, and it helps with performance. So the concept of exercise and nutrition just goes beyond health. It has to do with how someone functions and performs in their daily activities. So as an illustration, I might prescribe an exercise program, and yes, it may benefit the patient or client in terms of their future health status, may decrease the risk of having a heart attack, possibly prevent gaining weight, excess weight, and having diabetes. But beyond that, many patients or many clients just want to do things or enjoy leisurely activities better. Maybe be more active in the particular sport or hobby that they're interested in. I have more elderly patients that just simply want to play with their grandchildren, or maybe able to walk their pets around the neighborhood without pain, without fatigue. So the benefits of exercise and nutrition just goes beyond just the health considerations, but actually helps the patient or the client perform better in very mundane tasks, even things like moving furniture or carrying groceries around.